that 50% mark during the day if we haven't already hit it, and just on 80.7% of first doses. So please come forward and get vaccinated, whether it's your first dose or your second dose. In fact, I'd love to hear many of you who haven't been vaccinated yet to come forward with your first doses as soon as you can. To 8 p.m. last night, we had 1,284 cases of community transmission, and regrettably 12 people lost their lives. And we extend our condolences and sympathies to the loved ones of every person who has died in that time because of or because they had COVID. And again, every day the statistics are given out in detail, but behind every death is a family, is a group of people who are mourning, and our thoughts must go to them. And it's a constant reminder about how deadly and sinister and how contagious this disease is. It's always difficult when you can see the light at the end of the tunnel to stay the course, but we're really urging everybody to stick to the rules. There are opportunities for us to consider easing restrictions moving forward, but we really need everybody just to stay the course. We're getting inching closer and closer to that 70% double vaccination rate, which is very pleasing. So getting to that milestone of 50 gives us heart that in some weeks we'll get to that 70% double dose and enjoy many more things than what we can today, and start to feel more normal about life at that stage. I can confirm the New South Wales Government has already started work and planning on our 80% plan and what happens at 80% double dose. And one of the things that obviously we expect to occur at 80% double dose is to consider our international borders. That is Aussies coming back home through Sydney Airport, but also our citizens having the opportunity to go overseas when previously they weren't able to. And I'm very pleased today to be joined by Minister Ayres, who ordinarily is the Minister for Major Events and Tourism and a whole range of other matters. But today he'll be pleasingly announcing a home quarantine trial that we'll be doing in New South Wales. That will start in the next couple of weeks. The planning work's already been done. Minister Ayres will talk about that now. But it's really opening the door to what home quarantine will look like for us moving forward. For those returning Australians who have got double dose vaccinations, they'll be able to consider having a home quarantine setting rather than having to be in a hotel, similar to the hotel behind us now, which has had thousands of people come through it in the hotel quarantine system. I'm sure Minister Ayres would much rather those hotels were returned to tourists rather than returning Australians. Pleasingly, New South Wales has already welcomed home or quarantined nearly 250,000 Australians. More so, I would say probably as much as all the other states combined. This is our responsibility, not just to our citizens, but to Australia. All of us have to play our part in helping Australia open up and reconnect with the world, and making sure we do it safely and cautiously according to these plans. Minister Ayres will go through that. But can I just say very strongly, if you haven't had vaccination yet, please come forward and get vaccinated. It's really important for us, once we hit that 70% double dose, which we're likely to in around the middle of October, is to make sure we have as high a rate of first doses as possible, but also make sure that we have good coverage amongst the 12 to 15-year-olds, and all the reports I've received are very positive on both those fronts, and we really encourage people to focus on that, because that is our ticket to freedom and that is our ticket to living more freely. I just wanted to also stress that we are working with business and industry to make sure that there is certainty and clarity around what everybody can expect at 70%, and obviously getting their input as to what might happen at 80%. So Dr. Gale now will give the health update. Minister Ayres will talk about the trial of our new quarantine system, and I should also say that includes a number of other people apart from just returning Australians, which Minister Ayres will talk about, and then we'll take your questions.
Thank you, Premier, and good morning, everybody. To 8 p.m. Last night, there were 1,284 locally acquired cases of COVID-19 in New South Wales and 2 overseas acquired cases. We continue to see really good testing numbers. Yesterday till 8 p.m. we had 155,334 tests reported. As the Premier said, we are really thrilled to see our vaccination rates continue to climb, and a big thank you to all the community for coming forward in the numbers that you have to get vaccinated and particularly to residents in our 12 LGAs of concern who have really increased their coverage of vaccination remarkably in the last few weeks, and that's, from a health perspective, been really wonderful to see. So a big thank you to the community, and I'd like to encourage anyone who hasn't booked in for their vaccine yet or for their second dose to please do so as soon as you can. Currently, New South Wales Health is caring for over 15,000 people with COVID-19, and the vast majority of those people are being cared for in the community and in our special health accommodation. There are currently 1,245 COVID-19 cases admitted to hospital, 228 people in intensive care, and 112 people who are currently requiring ventilation. Of the 228 people in ICU, 172 are not vaccinated, 50 have received a first dose of a COVID-19 vaccine, and 6 people in ICU have received 2 doses of a COVID-19 vaccine. As the Premier said, today we're very sad to announce the deaths of 12 people, people who've lost their lives to COVID-19 and notified to us since 8 p.m. last night. They are 6 men and 6 women. Among these people are 2 who were in their 20s, 3 people who were in their 50s, 1 person was in their 60s, 2 people were in their 70s, 3 people in their 80s, and 1 person in their 90s. Of these 12 individuals who sadly passed away, 7 were not vaccinated, 2 had received 1 dose, and 3 were fully vaccinated. I'd like to provide a bit more detail about several of these tragic deaths. Firstly, a woman in her 20s from Western Sydney died at Nepean Hospital. She had received 1 dose of a COVID vaccine and had underlying health conditions. A woman in her 20s died at Gosford Hospital. She was not vaccinated and was a resident of the Life Without Barriers group home in Wyong, which is where she acquired her infection. 3 people passed away who were residents of aged care facilities in Dubbo. They include a woman in her 80s who died at the Holy Spirit Aged Care Facility. She was fully vaccinated and is the first death linked to an outbreak at this facility. A woman in her 90s was fully vaccinated, and a man in his 80s, partially vaccinated, died at St Mary's Villa Aged Care Facility in Dubbo. And there are now 3 deaths associated with an outbreak at this facility. 2 people from Western Sydney, a man in his 50s and a woman in her 80s, died at their homes, and their COVID-19 infections were diagnosed after their death, and neither of these individuals was vaccinated. I'd like to extend my deepest sympathies to the families of these individuals. Since the 16th of June, we've had 222 COVID-19 related deaths and 278 in total since the beginning of the pandemic. I'd like to call out some areas where we've had positive sewage detections and particularly ask residents of these areas to come forward for testing and to be vigilant for symptoms. And they are Uralla, Inverell, the Hunter Karua areas in the Hunter New England region, Coffs Harbour, Cowra, Narooma, and also Young. And I would say that we have also identified a positive case living in Young, reported till 8 p.m. last night, and overnight that person's household contacts have also tested positive. So there are a number of exposure sites in Young, and as we speak, New South Wales Health is providing advice to government around recommendations for the people of Young. But I would like to urge anyone living in Young to please monitor for symptoms, please look out for public health advice and come forward for testing if you have even the mildest of symptoms. I'd like to ask the residents of the following suburbs where we continue to see a high burden of cases, again, as you have been doing all along, to continue to follow the public health advice, get tested, get vaccinated, and those are residents of Greenacre, Guildford, Auburn, Bankstown, Merrylands, Blacktown and Liverpool. Please come forward to get tested. Please especially come forward to get vaccinated. And similarly, I'd like to ask residents of the Central Coast and Illawarra, where we are seeing increasing case numbers, to please be vigilant for symptoms, please get vaccinated, please get tested. Thank you.
Thank you, Premier. Thank you, Dr. Gale. Today is an important step on the reopening of New South Wales to the rest of the world. Our roadmap is really driven by the fantastic vaccination take-up rate by New South Wales citizens. And because of that, today we're able to announce the next step on that reopening strategy. We're going to start at the end of this month a trial that changes the way we do quarantine. It gives us the chance to test 7-day quarantine in the home. We're going to conduct this trial with approximately 175 people. They'll be broken across 2 cohorts. We've been working with Qantas aircrew and staff for a number of months now. We're going to include some of those people in this trial to be able to conduct their quarantine at home. They're doing shorter turnaround times, but some of their existing crew are in 14-day quarantine, so they're a logical cohort to do this work with. We're also going to work with police and health to select from returning Australians to be able to go into this home-based quarantine trial. This will build on the evidence that's been collected through the South Australian trial as part of the national plan, where we utilise technology, particularly facial recognition and location-based services, apps on your phone, to allow police and health to continue to check in on a person during their home-based quarantine. This is a really critical step to be able to build and operationalise a home-based quarantine system, so ultimately we can phase out for the majority of people hotel quarantine. We will always require a quarantine arrangement, particularly as more nations move through the vaccination status and the TGA recognises more vaccines. But until that happens, we do have to have the capacity to have quarantining in one form or another that's not based in the home. This is a really big step, and I think a light for every Australian who's still overseas, who because of caps haven't been able to come home. We want to be able to lift those caps. We want to be able to do that as soon as possible, but we want to be able to make sure we do so in a very safe way. This trial will allow us to do that. It will allow us to build the evidence that we need to operationalise and scale up home-based quarantine, and it represents a significant step in the reopening strategy for the New South Wales economy.
Premier, how will you choose who goes into this? How will you choose who takes part in this program, and will you be prioritising certain groups such as families with young children?
Yeah, so we're going to conduct the trial, excluding the Qantas aircrew. Will be about 125 people. They'll be selected by New South Wales Police and New South Wales Health, and we also want to be able to test across different cohorts. So families, singles, older people, younger people, people in different forms of work. This is a trial, and it's about testing different types of accommodation, apartments and homes. So we want to make sure we get the spread right. This isn't about prioritising individuals or people who have been overseas. It's about making sure we conduct this trial properly, build that base of evidence so that we can remove our hotel quarantine system for the majority of people who are coming into Australia. What I mean by that is those that are double vaccinated, so we can ultimately remove them from having to be in our hotel system.
What will the criteria be, though? Will it be random, and how can you ensure it will be fair? And when will people find out they're taking part? Is it when they land, or is it before they land?
No, they'll definitely be informed before they arrive. It's random in the sense that we're only using a small group of people, but we will want to make sure that the cohort represents all of the different conditions that we need to test in this trial. Bear in mind, we're talking about 125 people here. It's going to be conducted over 4 weeks. We're talking about 30 people a week. We want to make sure that we get that spread across, like I said, different types of accommodations, different types of age groups, different types of conditions. because we want to be able to learn what the hotel quarantine system needs to transition to when we've got home-based quarantine.
Minister, we only for vaccinated people. Will that still include vaccinated people? Still include children that can't get vaccinated if they're travelling with families? Will they be able to quarantine at home?
Yeah, so where we will apply the same conditions that we have at the moment here in Australia. So fully vaccinated people, where children are not applicable to a vaccine, and we're choosing people in a family sitting, those children will apply.
Do they have to live in Sydney, or can they be using Sydney to go to regions?
No, this is for New South Wales residents. We will want to be able to test people across different types of living arrangements, so we will look at people in regional New South Wales. Sorry, I just can't hear you, Tom. All of the people included in the trial will come inside the cap. We can fit comfortably the 30 people a week inside our current arrivals cap. So they'll be coming inside the cap to answer that question. We want to expand the amount of people who can come back to Sydney as quickly as possible. We want Australians coming back through Sydney Airport. We want international tourists coming through Sydney. So this is a really important step for that. We won't hold caps a single day longer than what we need to.
Everyone's going to be health advice. You're not only bringing in home quarantine, you're halving the length to 7 days.
Yeah, this is part of the national plan. We know that we've got to be able to adjust to different settings as we move to living with COVID. Part of the national plan in Phase A is to trial and test home-based quarantine options. This trial is endorsed by the Commonwealth Government. The 7 days is something that the entire nation needs to be able to see in practice. That's why we're doing a trial before we step that out into a wider cohort of people.
And how will those people be transported from the airport to home? What are the rules around the drivers transporting them?
So we'll operationalise the movement from the airport to their home-based location the same way that we've operationalised the movement from airports to hotel quarantine.
If you do the program successful, how long will it take to come online for more than your original cohort?
Yeah, we want to be able to open up Sydney and New South Wales as quickly as possible. So this is a really crucial step. I can't tell you exactly how long it will take to transition from the end of the trial to a scaled up home-based quarantine system. That's why we're doing the trial. We want to learn about what happens inside the home environment. We want to be able to test the capacity for technology to be able to ensure people stay in their home-based quarantine conditions. We want to be able to make sure that health and police have all of the information and contact points that are required. And we also want to be able to make sure that people get the support that they need as they're going through their quarantine arrangements. We've been offering that whilst they've been in hotels. We need to be able to do the same thing. The trial is an important step. We need to learn a few more things about how home-based quarantine will work. That's what the trial will do. But make no mistake, this is a massive step forward. We're sending a really clear signal that the future of hotel quarantine will end for people that are double vaccinated. This is an important step about getting to that objective.
What's the protocol if someone tests positive?
Well, for starters, we'll only be choosing people in the trial setting that can utilise that technology. We want to be able to work to identify how you might utilise different forms of technology. The application that's been used through the South Australian trial is performing well. We want to test it in New South Wales, but also testing technology allows us to identify where those weaknesses are. So if we have to come up with alternatives for people who don't have access to that technology, it's exactly why we need to test it at the moment.
Minister, what's the protocol if someone tests positive? How long do they have to stay at home until they're released? Is there any guidelines South Australia's giving you on that? Or?
No, so the testing regime will be exactly the same. If you end up testing positive, you'll have to follow the advice from public health and maintain isolation. I don't think we'll be charging people to stay in their own home.
Why only 7 days, whereas everyone else in the hotel quarantine system still has to do 14? Why not reduce the hotel quarantine system to 7 as well?
So this is a trial to be able to test and identify ways in which we can change the future of quarantine. We know that we've got a functional and very stable working system around 14 days, but we want to be able to reduce the time people have to stay in quarantine. So we're taking the advice of health to be able to reduce that exposure. It's something that we want to be able to do in the longer term, and if we can continue to reduce that to even lower, we will. But the natural step here is to go to a 7-day home-based quarantine trial, take the evidence from that, and start to apply it in future decisions.
Well, can I ask you a broader question?
Sorry. Yes, absolutely. Part of this will mean a testing regime for those people after they've completed their 7 days of home-based quarantine. Please be aware, only people who are double vaccinated with TGA accredited vaccines will be selected in this trial.
Minister, does that mean people with the Johnson & Johnson vaccine, a lot of them in America and their Australian citizens, won't be able to use the system?
So I just want to draw a distinction here. The TGA does accredit different types of vaccines. The TGA is working through accreditation of international vaccines at the moment. We will work closely with the Commonwealth on that. That is slightly different from the approvals for Australians to be used here, the vaccines that we're using in Australia. So we know that there's a diversity of vaccines. We want to be able to work with the Commonwealth to ensure that the TGA can accredit different types of vaccines so Australians who have used different vaccines can still come home.
But just to be clear, it's only the 3 vaccines that the TGA have approved at the moment that will be part of the pilot.
That's correct.
So Johnson & Johnson's excluded.
Yes, that's correct.
Premier,
How
can I
are
ask
you
a
leaving
broader...
Australia vulnerable? Other than Australia vulnerable, hopefully, potentially bringing other COVID strains to Australia?
No, I think this is a proportionate small trial. We're talking about 175 people over 4 weeks, all double vaccinated. We can't stay closed forever. We've got to be able to learn what happens when we put people into home-based quarantine. That's what this step will do. Australia must reopen. We must get rid of lockdowns. We must get rid of home quarantine. We must re-engage with the world. Sydney is a global city and it must engage with the globe. This is an important step in that direction.
Premier, can I ask a broader question on hotel quarantine? Over the past, just this month, we've had nearly 23,000 locally acquired cases in New South Wales. I believe we've had 30 coming through identified in hotel quarantine. Is it not time to do away with hotel quarantine entirely for people who are vaccinated?
Well, I think I made that very point several times about a month ago, saying given the number of cases we have in the community versus the number of cases in hotel quarantine, that we have to re-examine as part of the national plan how we transition from the current system to a better system which reflects what's going on and what living with Delta means. And the one strong measure we have now, we didn't have before, are very effective vaccines. So when people are double vaccinated with a vaccine which our Australian health authorities regard as safe and effective, well, obviously we can look to that. And today is the start of that process. It's the start of a process where returning Australians, returning groups of people who have received double doses of a safe vaccine can have alternative arrangements instead of the 2 weeks in a hotel. And nothing would give us greater joy than having our hotels return to tourists and having hotels return to others apart from those Australians having to do hotel quarantine. And certainly I know other states have still got New South Wales residents or other residents in their hotel quarantine systems, or their own citizens in their hotel quarantine systems for their own state. I mean, we should all be thinking about how we transition, how we move to the new system. And obviously as we're approaching the 70% double dose and as we're approaching the 80% double dose, we want to make sure we have all this in place. And the guidelines we'll be applying to this trial have come from the federal health authorities, working with our state authorities. And these are the guidelines which all of the states will have to proceed with in order to make that transition. Sorry, Tom, can you speak up? Well, obviously, those issues about existing restrictions and mask wearing in certain settings are reviewed almost daily. And as we get closer to the 70%, we'll obviously have more to say about that. If health gives us the green light to say more about that before then, we'd be very pleased to do so. What we wanted to do with our 70% roadmap is provide certainty to our citizens and to business as to what would be allowed at that target. Now, there are still some areas we need to cover. What does the world look like at 80%? What does the world look like in relation to other restrictions, walking outside and who you can interact with? So these are the broader issues which health is giving us advice about. But we wanted to make sure with our 70% roadmap we gave certainty to business, to citizens, as to what we'd be able to do once we hit those targets. And I'm very pleased that New South Wales is moving forward together. We've got some of the highest vaccination rates in those communities with the highest number of cases, which is a good thing. It means those communities have that extra layer of protection when we do start opening up. And of course, what we're doing now is making sure we identify all those pockets where there may be low vaccination rates and have specific strategies. As we did in Western and Southwestern Sydney, we had very specific targeted strategies, and that's now resulted in some of those communities having the highest vaccination rates in Australia, not just New South Wales, but in Australia. And we're applying that same strategy to other pockets across the state, because my intention, Dr. Chant, Dr. Gale, all of us want to make sure that when we get to that 70% double dose, that as many people as possible have had at least the first jab. And I'm absolutely pleased that we're going to get to the 80% double dose target. Many countries around the world still haven't got there in terms of 16 and over. But I'm also pleased that a number of 12 to 15-year-olds will be and have been getting vaccinated as well, and that gives us that extra bit of coverage.
The first vaccine drive-through has been opened up in the city at the first today. Would you like to see more of those open up?
Oh, look, I think, can I firstly thank all the GPs and pharmacists for being so innovative in the way they're offering vaccines. Those vaccines obviously go directly from the Commonwealth to our GP network, and I commend and congratulate GPs who have a very innovative approach to how they can vaccinate their communities. And all of us, all communities have a very strong connection. All local areas have a very strong connection to their local GPs. And I think GPs also understand how they can best provide that support to their own local patients. And I'm encouraged by the innovation, and I'm really pleased that the first one is occurring. And I suspect there'll be lots of other GPs and pharmacists which also present that flexible, innovative way to support families locally.
Premier Daniel Andrews has opened up the restrictions to 10 kilometres for Victorian residents. Is that something you're considering and something you might do before 70%?
Oh, look, it's possible that if the health advice reflects that, we will, but we're really keen to make sure all of us move forward together. So if the health experts give us that advice, nothing would give me greater joy. I mean, it's often, most days when we come here, it's often difficult news we have to convey. Nothing gives me greater joy than when we're actually lifting restrictions or providing roadmaps and telling people what we can look forward to. And given what we've been through in the last few months, the journey to get to 70% double dose isn't very far away now. We're getting there. So I just want to encourage everybody to say that, the second that we get the green light to ease off on anything, we will. But just stick with us until we can make those announcements, because we need to stay the course. As you know, the modelling told us that we'd reach our peak sometime in mid-September. We're kind of around mid-September now, a bit over mid-September. We don't know whether the worst is behind us or not in terms of cases. So it's best for us to make sure we stay the course for a little bit longer until we know for sure. And then obviously health can reevaluate all of those settings. So I'll just ask someone else and come back. Yeah. Oh, look, this is something I really want to make clear. The GPs get their doses of vaccine straight from the federal government. They don't come through us. We get our doses from the federal government as well. So we can't control where the doses go to. So what happens is the federal government says to the GPs, here are your doses. It says to the pharmacists, here are your doses. It says to the state government, here are your doses. And what we need to do is manage how we can best target those communities we need to. So that's why I really commend GPs for doing that. Thousands of GPs have just stood up in New South Wales, and hundreds at least, I should say, if not thousands, have just been part of the success story of our vaccination rates. We couldn't have got to these rates without our GPs. GPs are so connected to their local communities. Often GPs also spend the time with every single patient to explain to them how important it is to get vaccinated, and we can't thank our GP network enough. And on top of that, the pharmacists have a similar role. They know their communities, their patients very well, having dealt with them over a long period of time, and that trust really helps with those local vaccines. But I just want to make very clear that we don't control where the vaccines go. What we do control is to make the most of what we're given and to work closely with GPs and pharmacists. When we have information on where the doses are going, it then allows us to target where we put our doses. And that's why we've been very successful in some Western and Southwestern communities. The vaccination rate was around 18 or 19% at the beginning of the outbreak. Now those same communities are having vaccination rates in the 80s or even 90% first dose. So that is the situation. We'd love to be able to control how we get the vaccines, when we get them, but that's all decided by the federal government. They provide those vaccines directly to the Commonwealth, directly to the pharmacists and directly to us. And of course we have a number of pop-up clinics, max vaccination centres and also outreach services as well, whether it's through mobile vans or whether it's going to places of worship or community groups as well. So in combination, our vaccination strategy has resulted in the higher rates we're seeing.
First doses of Moderna arrived tonight. How do you see that as helping to roll out? And will it allow more supply, allow more things like more hubs?
The vaccine will be mainly administrated through pharmacists. So I understand we're getting a little bit of the proportion, but most of it will go through pharmacists. And we're really encouraged because obviously 12 to 18-year-olds are only recommended to have either Moderna or Pfizer. So we're encouraged that many younger people will be able to access Moderna and Pfizer through their GPs and through their pharmacists, especially from next week with Moderna. So that's really encouraging because, as you know, the 12 to 15-year-olds aren't counted in our targets. So any vaccinations that we can administer to 12 to 15-year-olds are a bonus. It means we have greater coverage across our entire population.
Just on other matters, Premier, if you're happy with that.
Is there any other COVID questions or COVID-related questions?
I do have one on timing, Premier, for hotel quarantine. I mean, obviously everyone wants to get to the point where we're not worrying about the hotel quarantine system, but it's 2 weeks until this trial starts. It'll run for another 4 weeks. Then you've got to go through the results of it. I mean, is it still months and months away before people broadly are going to be quarantining at home?
We envisage things to move rather rapidly if we see good success, because the hard work's really already been done. The planning is the hard work to facilitate how you'd operationalise it and how you'd plan it. And I guess certain assumptions have been made as to what the results will be. And we'll work very quickly to scale up. I think we've demonstrated our capacity to make a trial become reality very soon. Just like Minister Dominello is working on the vaccine passport through Service New South Wales, as soon as we get the data on vaccines from the Commonwealth, we'll be making sure that vaccine passport's available once we hit that 70% double dose. So I think people should feel very confident that we will move quickly. As I've said, I'd love to see returning Australians for Christmas. I'd love to see Australians considering overseas holidays, overseas reunification with families, as in people in New South Wales are looking to international travel as well. And so the quicker we get through this process, the quicker we hit the 80% double dose, the more realistic all those targets will be. And I'm very, very optimistic about moving quickly. And I know the Commonwealth Government is also very optimistic about that. And I'm also confident that New South Wales, Victoria and South Australia, New South Wales and Victoria will be in a similar situation, and South Australia is keen to open up to the two largest states. So I think there's possibilities for us to move together, and I hope the other state leaders join us as well.
Last few questions,
Just on other matters.
Oh, look, we're very keen, of course, for life to get back to normal as soon as possible, but it has to be done in a safe way. We're obviously looking forward to hitting those 70% double dose figures. We have to be very cautious when we reopen. If you kind of relax too much, we will have too many people end up in hospital, because that is what is the result of opening up too soon and not doing things in the proper way. So we have to consider all those challenging things. Nothing would give us more joy than being able to open up to events and open up to things that we're used to doing, but we have to do it in a safe way. And as we get closer to that 70% target, we'll be able to know when that timing is and what that means for certain events.
Are you concerned about the release of Mohammed Scuff with a parole, given that there hasn't been any remorse shown for those crimes that have been committed?
Those decisions are made by the Independent Parole Authority, and I'll seek advice from Minister Roberts on those matters.
On to Marianne on the situation
Dr. Gale.
Dr. Gale, sorry. First time here. On the situation in Redfern and concerns about those social housing towers, and do we have updated figures on how many people who've tested positive are Indigenous?
Well, I don't have the figures on exactly how many people who've tested positive are Indigenous, but we do know that our local services work very closely with the Redfern AMS and have done since the beginning of the pandemic. There's been a long-standing close collaboration with Redfern AMS, who do a wonderful job with the Redfern community and the Aboriginal community there, and there are Aboriginal health workers involved in supporting residents in the towers, because clearly there are a number of Aboriginal families implicated with the situation in those housing blocks. So that's where things are at the moment. We continue to work closely with all local parties, including Department of Communities and Justice, to make sure that all the supports are there necessary for the people in those buildings.
Are there any more cases there, Dr. Gale? Sorry to follow up.
I think there are 18 people now diagnosed, which is an increase from 12 as of yesterday.
Minister Ayres, can I just ask you one more question? Just in relation to the airport, I understand that the runway design has been released. Is it time that residents around there had the flight paths released, and there'd been some more communication in relation to that?
In Western Sydney Airport, yeah. I haven't actually seen the runway design, but the angles of the runway have been pretty well known in the public domain. I think there's ample opportunity before the airport opens in late 2026 to be able to have a very open and public discussion about flight paths. I've got no doubt that the Commonwealth Government will lead that. It falls in their jurisdiction, and they'll do that when they're ready to do so, when it's appropriate.
Minister, well, just quickly on the trial, will people be able to apply to be part of it, or do they just wait to be tapped?
Selected by New South Wales Health and New South Wales Police.
Thanks, everybody.
Thank you.